So propofol, the dose is already put there because it's a standard dose, 10 milligrams per ml. So I'm just going to put the date. So say today is April 11th, my initials. Fentanyl. The standard dose is 50 mics per ml. If I reconstitute it, for instance, if I were dealing with babies, I would need to cross out the 50 and relabel it. Lidocaine. The lidocaine that I'm using comes in a concentration of 10 milligrams per ml. Put the date, my initials, okay? Rocuronium, the standard rocuronium vial is already reconstituted at 10 milligrams per ml. So I just put the date, my initials. Some medications come already reconstituted for you, and some of them you can basically reconstitute it the way you want. For instance, your neosynephrine, when you make a mix, okay, the concentrate is 10 milligrams per ml. We usually reconstitute it to 100 micrograms per ml. Ephedrine, I reconstitute mine to 5 milligrams per ml. So after doing all that, right, you'll attach your labels to your syringes before you even withdraw the drug. Labeling practices. It's best to put the label right around where the demarcations for the volume is, because this is how I'm going to lay the syringe. You see that it's made to lay flat like this, upright, so you can see what the volume is and the drug name, concentration, date, initials of who drew it up. This is a syringe, 3 ml syringe, because most of the fentanyl I'm using come in 2 ml doses. I rarely need to give more than that for most surgeries. My lidocaine, 1% dosage, 10 milligrams per ml. I use a 5 ml syringe for it. This is a blank one. Okay, this is a 10 ml syringe. So for instance, if I were to reconstitute cefazolin for use as an antibiotic, I will use the blank labels here. Cefazolin, 1 gram. Okay, and the date, my name. If I just put 1 gram, it means the entire syringe is 1 gram. Oh, you could put 1 gram per 10 ml for more clarity. So we peel the label and place it right there. Okay. So medications that are not utilized right away need to be labeled. Medications that are utilized right away are the exception to the rule. If you pull the medication from the vial and you withdraw it and deliver it to the patient right away in the entire quantity, and you dispose of the syringe, that is appropriate medication administration, because you verified the syringe, the medication, the concentration, and you administered it. But if you're handing it off to somebody else to administer, then you need to label the syringe. If you're going to give a partial dose and then lay the rest down on your counter, it needs to be labeled to avoid medication errors.